Welcome to Coastal Front. Join us each week as we sit down with the movers and shakers of Vancouver to discuss stories of business, politics, accomplishment, and failure. Our aim is to keep you dialed into what matters most in our city. Now, here's your host, Andrew Johns.
Excellent. Well, here we are with Joan Isaacs. You are the MLA for Coquitlam-Burke Mountain.
Yes.
Thanks for being here today. I'm very excited to have you on our show.
Thank you for having me, Andrew. It's exciting to be here.
Yeah. Now, before we talk about how you got into politics and some of the important issues that we just started talking about this award you won.
Yes.
And I did hear about it from a couple of weeks ago. So we've got it up on the screen here, and you got a big smile there with your award. Can you tell us what you just got awarded with?
Well, it was the Senior Advocacy Award, and it was given by a home support services company that's the second largest in North America.
Okay.
They give this award every year to someone who they feel is speaking up on behalf of seniors, being an advocate, and somehow can make a political change or change what's going on in the world of seniors. So they have 6 awards in total.
Okay.
4 in the U.S. and 2 in Canada.
Wow.
And so Home Instead nominated me and awarded me the Senior Advocacy Award for Canada.
Wow.
Yeah.
Wow. Congratulations. That's
Thank
really
you.
big. So you're only one of 2 Canadian winners this year.
One of 2, yes.
Wow.
It's quite an honor.
Wow.
I'm very humbled by it.
Yeah.
It's a very significant award.
Mm-hmm.
I have been working very hard over the last couple of years to try and bring issues about seniors and their concerns and some of the issues and challenges that they're facing, which incidentally are very similar to the challenges and issues that my parents faced 20-some years ago.
Okay.
Not a lot has changed.
Not a lot has changed?
Not a lot has changed. And people certainly as a family go through the same emotions about when a senior is needing more care or needing support at home or having to actually go into care.
Right.
So it was an honor to receive the award and to be recognized for it.
Yeah.
I had a reception in my office, invited 60 people that came and to support me, and it was wonderful.
Oh, great. Well, that's excellent. Well, I'm sure we'll spend some time talking about this during the podcast because obviously you're subject matter expert in, and I believe that you're actually even one of your titles within the Liberal Party of BC is you are the
Seniors Critic.
Seniors Critic.
Yes. So I was the Seniors Critic. I was co-health critic originally, and then we carved out Seniors Critic out of the health file.
Okay.
And I was that up until the time I was appointed as the Assistant Deputy Speaker.
Okay.
So normally at an Assistant Deputy Speaker level, you don't actually have a portfolio.
Oh, I see. Okay.
Yeah.
Yeah. But you're obviously still very passionate about this.
Very much so.
Yeah.
And as an MLA, I'm passionate about a number of different things. So not just the critic role, but, daycare, quality of life, businesses and how they compete, the economic drivers and how we develop economics in the Tri-Cities, but also around the province.
Yeah.
So many areas as an MLA I would certainly be interested in. But
of
course, seniors, I lived with my parents.
Right. Okay.
And so I certainly know those challenges.
Okay. They lived with you. You helped take care of them, did you? Or?
Well, my father got sick very early on. He was only 62, and he had dementia, vascular dementia.
At 62?
At 62 was the first part of the diagnosis.
Yeah.
And for most people that know when they get some kind of a life-changing diagnosis, there's this lead up to something's wrong, but we don't know what. But you suspect something's wrong.
Right.
And you live with that for a while.
Yeah.
And then you get an actual doctor's diagnosis.
Yeah.
And then the second part of that journey begins. And life is never going to be the same.
It doesn't get better, right?
It doesn't get better.
No.
And so there is a process that we went through with my father. And then he was in Kelowna with my mom. And then eventually we moved him to Coquitlam.
Okay.
So he was closer to us. And
Yeah.
And then later my mom was in hospice care.
Okay.
And she lived in a residential home for only about a week.
Yeah. I've been through that. I mean, unfortunately so far not with my parents, but I've been through that actually with one of my close friends when he got cancer. And so So
those
hospices are really they're a critical part of the closure.
Absolutely.
Yeah.
Absolutely.
And the care of the sort of end of life. Yeah.
Yeah, and it's funny that 3 years before that, I had taken the hospice course.
Oh.
because I just had a lot of time that I was looking at how could I volunteer and give something back in the community, and that was one of the things that was of interest to me. Again, because of my experience with my parents.
With parents, yeah.
So I had no idea that training would come in later.
Yeah.
And so our whole family kind of benefited from that experience because we kind of knew what to expect.
Right.
And it was really a lot about sharing your story and celebrating life while a person is still there.
Well, they're still there. Yeah, 100%. Yeah, I always wonder about, I always like to see when people get awards or recognition while they're still alive, because there are some great people out there that contribute a lot to society. And it's always nice when they get recognition, big recognition, while they're still around to appreciate it.
Yes.
And see
Actually, I have a cousin in Calgary who many, many years ago, so this would be, I don't know, 25 years ago or more, even more.
Yeah.
He had his funeral while he was still alive. He had terminal cancer.
Oh, wow.
And he was written up in the Calgary Herald, and it was quite a big, bold step to have your own funeral before you actually left. It was pretty interesting.
And you obviously, I'm assuming you went?
I didn't. No, I didn't, because I lived in BC and I was working. I couldn't get there.
You weren't able to go.
But I used to speak to him on the phone quite frequently.
Yeah. Wow. Well, that's really neat. Well, Joan, we will definitely get back into the seniors. Let's talk a little about pre-politics. I mean, you're, first of all, just to be clear, you're a fairly new MLA.
I am.
Yeah.
I am. Only 2 years into it.
Okay.
And it's a steep learning curve.
Yeah.
There's really no orientation or booklet of how to.
Yeah.
It's really trial and error.
Yeah.
And you get thrown into it right away.
Like having kids.
It kind of is like that. Yeah. Except everyone's watching.
Right. Yeah. Exactly.
So it's a little bit different. It could be intimidating if you let it be.
Right.
But I guess I feel like I have something to bring to the table because I've had a business background and owned many businesses and been in the financial services industry for over 30 years.
Yeah.
And most of that I owned and operated mutual fund dealerships.
Right.
I certainly know the ins and outs. And then, of course, when you're talking to clients, you hear their stories as well. And so you realize how deep things go and how many sectors and get affected when there's changes in the marketplace or in business cycles or whatever. So I feel that is a good contribution to bring to the table.
Oh, I totally agree. It reminds me of when I was at university, and I used to look at my profs into two categories, and I always appreciated the profs that came from private sector, and they were just teaching a course part-time, or they had at least spent part of their career outside of the university realm. Mm-hmm. Then you had those smaller subsection, and no knock to those people, but the people literally were lifelong university. They went to school there, got their degrees, got their PhDs, and then started teaching, and they never really worked in the real world, as I like to say. Whereas it's in the same sort of spirit, like someone like yourself coming to the table, you've ran a small business, you've employed people, you've paid taxes, you know how hard it is to run a business. You may or may not have had success, but you sure as heck would have gone through a lot of challenges and failures.
Yeah,
and
absolutely.
That's the kind of stuff that I think is invaluable, whether it's you're leading a school or you're leading the province and governing the country, the province. Yeah.
Failures is an interesting word because I think it's subjective. You just have a different experience than what you thought.
Yeah, sure.
Right, and you grow from that experience, and you use that to your advantage, and you become smarter or more focused, or however you want to use it. But it's really you take that experience and you make it better, or you make the best out of it.
Yeah, absolutely.
Yeah.
Okay, so you ran these various businesses, largely working in the mutual fund industry.
Yes.
For most of your career.
Yeah.
And insurance.
For a number of it, yes, a number of years. And I sold my business, and then I went into business development. So I was helping advisors across the province with their business and more about raising their awareness and finding their niche. So there were 60,000 registered licensed financial planners across Canada. Why are you any different, and why would I want to deal with you?
Right.
And there were lots of reasons but people often don't identify their own reasons.
Yeah.
They need someone to help them with that.
Yeah.
So I would do that and help with organizing their administrative issues and hiring, recruiting, that kind of thing. And then worked
And
with,
who was it? Did you work for yourself or did you work for a company?
well, at the company that bought me,
Yeah.
I worked as a business development with them for 2
Okay.
years, and I actually went around and bought other companies and folded them into this bigger
okay.
company. So there
Yeah.
was kind of a cultural change too of integrating different companies into one.
Yeah.
And of course, it's different because usually in a small dealership, there's the hierarchy and the top salespeople who in a new company may not be in that hierarchy anymore or be top salespeople. So there's a lot of sort of working with people to make sure that they don't lose their momentum and their confidence that what you're doing is fantastic and you're a big part of this contribution to a bigger company.
Yeah.
But I did that for a while, and then I worked for another company that I had been friends with for 20 years before, and he wanted to buy our company, and we ended up selling it to someone else, but went back with him and did business development there as well.
Okay.
And then actually I did some wholesaling too.
Oh, did you really?
I did. I worked with AIC, which is Michael Lee Chin.
Yeah, absolutely.
Yes.
I used to buy their mutual. I don't even know if they must
Buy,
have
hold, and prosper was their
that's
thing.
right.
Yes,
yeah. My early days of starting the business, I had clients buying their funds.
Yes.
They had one fund, I remember, it was just phenomenal performance. But are they still around today?
I think they are, but they're in a different name. They're in a different name. Yeah. As many companies are. There's lots of mergers, and certainly over the years, there's been many mergers and company names that have changed, and it's hard to even identify.
Yeah, there's been a lot of
who's left.
disruption in that space.
Yeah.
So you were a wholesaler for them, and then...
Yeah, and then I was a wholesaler with Tim McElvain over in Victoria as well.
Okay.
And then at the same time, I was doing some community work.
Okay.
So I was involved on the homelessness task force in Tri-Cities.
Okay.
And then I did Homes for Good, Ending Homelessness, which was a Homes First project in Coquitlam and Tri-Cities.
Okay.
And
just for those listeners who may not be familiar, can you just clarify where the Tri-Cities are?
So that would be Coquitlam, Port Coquitlam, and Port Moody.
Yeah. Okay,
yes,
great.
yes, and it's to some extent we're including Belcarra and Anmore,
right?
Because we all travel the same roadways.
Yes,
we're all part of the one big family.
Yeah.
So it's the 5 boroughs is what I think it should be called.
I like that.
But that's not going. It's not going anywhere yet.
Yeah.
But if New York can do it, I think we could do
Why
it
not?
too.
Yeah, 100%. I like it.
Yeah, I do too. So anyways, then I basically worked with developing all the intake processes and everything on the Homes for Good and housing people.
Yeah.
And
was there or is there a homeless issue in the Tri-Cities?
Yes, it was growing, as every community has a growing homelessness population. And we were in the process of getting a transition home and shelter built, which was 3030 Gordon. And so that was one big project that would help, but there were many other nonprofits that were organized and helping people on the ground as well. So, and it still continues to be a very big problem. It didn't go away, and in some of the transition houses and shelters now, you find that it's not just the local people that are there accessing the resources. There are people that have come from other areas that are accessing resources too.
Oh.
Yeah.
Because they, I guess, hear about it?
They hear about it, and it's just where can you get the access to those resources?
I see.
Yeah.
Okay.
Yeah.
So you're doing this volunteer work, and what sort of give us a time frame? When is this? Roughly?
Well, so that I started that about 2010.
Okay.
So that my first project was a company called New View Society, which is mental health and addictions organization. Been around for 40 years. Okay. No one had ever heard of them. They're very low key. And I was on the board first, but trying to raise awareness of the services that they were providing, because I really felt that they helped to manage our homelessness crisis.
Sure.
because they had people in services and programs.
Yeah.
They had group homes that were supervised. They had people checking in on them, and lots of social activities that kept people connected.
Right.
And I thought they were just, no one knows about these people, and they're doing a fantastic job.
Yeah.
And so they had outgrown their house that they had, and they were doing a capital campaign project, which was about a $3 million project. And so I switched from board of director to their fundraising chair.
Okay.
And raised some of the money to go forward with that project.
Wow. Okay.
And so it's a fantastic project. But I learned a lot about mental health.
Yeah.
And got to know a lot of the people there that were suffering. And they were fantastic people.
Yeah.
Yeah, fantastic
great.
people.
That's great. You got involved with that. And then from there, where did you go from there to, because that was about 2010 you were saying?
Yes. And then, what else did I do now?
You were saying you also,
have to cut.
Yeah, that's okay. You were saying that you also took a hospice
Yeah, I took a hospice course. Yeah. That would have been probably in about 2008.
Oh, okay.
Yeah.
That was before.
Yeah, that was before. I sort of did that at the same time, and read a very interesting book called The Art of Listening.
Okay.
Which is a very good book to read.
And that's for people who are needing to deal with this type of...
Or just to be a companion to someone that is going through that.
Yeah.
Because a lot of people like to end up talking about themselves.
Right.
And really you want the person to talk about themselves. It's not about you, it's about them. So it becomes a listening exercise.
Yeah.
But it was more my way of doing things anyways, because I've always, even in my sales career, have always been more consultative.
Yeah.
Which is listening.
Yeah.
Right.
Yeah, absolutely.
Yeah.
Well, years ago, I remember the former firm I worked at, one of the founders and CEO, Ken Shields, said, we were born with 2 ears and 1 mouth, and we should use those in that ratio.
Yes.
Yeah.
Yes. I remember Ken Shields.
Oh, do you remember Ken?
Yeah. Old name from the past.
Yeah. He was a very inspiring guy for me when I started in the business.
Yeah.
Yeah. So when did the world of politics? I mean, it's obvious that you were not politically driven, or you're not a lifelong politician by any stretch. So when did that come onto the picture for you?
Well, it came on when an opportunity arose. So the terms for MLAs are every 4 years.
Yeah.
It's not frequent that they turn over. So there's always 2 or 3 terms, often for an MLA.
Yeah.
So the opportunity doesn't present itself that often.
Had you been thinking about getting into politics?
I hadn't been thinking about it seriously. I thought maybe one day I would do it.
Yeah.
But I'll tell you what really sort of made me take the leap is when I was on the Joint Family Court and Youth Justice Committee, we did a thing on bullying.
Okay.
And it was just about 10 days after Amanda Todd's suicide.
Okay.
And the whole community was just in grieving for this loss of this young girl.
Yeah.
And it really came to the forefront of what bullying is, how rampant it was in so many different areas. And so we put on a forum, and we had 7 experts come in, and they were experts in each one of their different fields. So employment, in sexuality, in house, and on the street, in the schoolyard. And we had over 400 people come and attend the session. We partnered with Red Cross, and they did a fantastic video called Bullying Ends With Me.
Okay.
And it became a really big thing in the community. And the feedback forms was, we need more. So we ended up doing another 6 series of different bullying tactics and how to not be a bystander for bullying. And that's how you end it, is not being a bystander.
Yeah, absolutely.
You take some intervention action.
Yeah.
And
sorry, Joan, this was through what organization?
The Joint Family Court and Youth Justice Committee.
Okay.
So that's a municipal, it doesn't exist anymore, but it's a municipal committee, a statutory committee. It's evolved now to restorative justice, and I was also on that board for restorative justice.
Okay.
But essentially, sorry, I lost my train of thought.
We were talking about the bullying, getting involved in addressing how rampant bullying was.
Yes, yeah. So when we had finished off our series,
Yes.
we have, at the end of our term, we were to write a report about our experience and anything we wanted to change in the justice system. So I wrote a 18-page report and to send it to the Minister of Justice federally and provincially and asked them to change the criminal code. And I had a great response back from them. I wanted the police to document on their documentation when they were processing files to indicate act of bullying or bullying, so that it could be scanned, it could be highlighted, word find bullying, because it wasn't the punch 2 months later that
Right.
was the incident. It was the bullying that led up to the incident.
Right.
Yeah. So
That's a really good point.
Yeah. And so
Did they
were
start doing that?
They didn't actually do that,
No? Okay.
but they did come up with federally, they did come up with the sexting text. So it's a criminal offense to
Right.
send a sexual text,
Yeah.
a picture without a person's consent.
Yeah.
But the comments were well received. And
great.
so when I saw that and how positive the comments were,
Yeah.
I thought, I know I've always made a difference somewhere, and that this would be a natural path through the political realm to make a bigger change and to make a difference, because it's all through policy
Yeah.
and regulation.
Yeah.
And what better place to have a policy change than at the government level?
At the government level, yeah.
MLA level.
MLA level.
Yeah, yeah.
So when did you write that 18-page
That was in
letter?
2012.
2012. Mm-hmm. And then when did your opportunity come up to actually?
2015.
2015. Okay.
Yeah, so it
who
was
was
a
the
few
MLA
years later.
in your writing
Douglas
before?
Horn was the MLA. And
Douglas Horn?
Yes,
Okay.
and he was a two-time, so 1.5, I guess.
Yeah.
And he vacated the seat to run for the Federal Conservative Party. And so that left a vacancy.
Yeah.
And so it triggered a by-election.
Oh, I see. Okay.
So I ran in the by-election.
And he was a BC MLA.
Yes,
he was a BC Liberal.
Yeah,
Okay.
BC Liberal. It's
Okay.
always has been a BC Liberal riding.
Okay.
For the most part.
Yeah. Okay.
And during the by-election, it went NDP.
Okay.
For the 18 months, and then in the general election, it went back.
Did
to
you run in the
Liberal.
by-election?
I did.
You did, and you
I
and
did.
you lost.
And I lost, but
interesting.
only by 400 votes or something. I think
Yeah.
wasn't very much. It was actually quite a high level.
Yeah.
Considering that most by-elections are not won.
Yeah.
By the government in power. I think there's only been 3 over 100 years or something like that. It's just not common. Yeah.
Oh, interesting.
Yeah. So I knew kind of going in,
Yeah.
it was a bit of a.
I didn't know that stat
Chance.
was stacked against you.
It is kind of stacked, but then again, if you don't take the jump,
Yeah.
then during the by-election and kind of put yourself forward, it does help.
Yeah.
And certainly you get to know what the issues are when you're on the doorstep talking
Yeah,
to people.
sure.
They really do open up
Yeah.
and tell you the issues, and that's the best way
Yeah.
to find out what's going on.
Yeah.
And so you're just so much better prepared when it comes to the general election.
Yeah. Yeah.
Yeah. If you
as
hang in there.
Yeah, absolutely. If you go in for
Yeah.
round 2.
Yeah, you
And
got to hang in.
Yeah. And like you said earlier, you made reference, I used the term failure, but you said it's just an experience you didn't expect.
Yes.
And I'm sure
yes.
you learned a lot from that.
Absolutely. Yeah.
I know a lot of
Yeah.
people who ran a by-election, didn't win,
Yeah.
and then actually one of the city councilors for Saanich, Rebecca, and I always get her last name wrong. It's like Maricero.
Yeah.
Mercero. I think it's probably French.
Mercero.
Yeah.
Really wonderful woman. And she ran in the by-election and lost. And actually, I think she even ran she ran a city council, and she ran another time and didn't win. I can't remember. I think it was twice she lost. But anyways, the last municipal election, she ended up getting more votes in the district of Saanich than anybody else.
Wow.
So it goes to show you
Yeah.
that you got to stick it out.
Yeah. Well, sometimes that name recognition makes a difference.
Right.
And like for me, I wasn't political.
Yeah.
Nobody knew who I was.
Sure.
And actually, when I had my business, most of my transactions were downtown.
Right.
And my network was downtown. My advisors were not in my
Tri-Cities
area.
is where your home was.
Yeah.
So you lost the by-election by 400 votes.
Something like that.
Okay. And then you go into, and then 18 months later, there's a general election. And you go up to run against your competitor with the NDP. Did that person, who's it?
Jody Wickens.
Jody Wickens. And did she rerun for her
Yes.
seat? Okay.
Yeah.
And then how did you do that? I mean, obviously won, but what do you know? Do you remember what the results were?
Yes, I don't think I'll ever forget them because it was a long time coming. There was a counting error by Elections BC, so that was rectified. So 153, I think it was, votes came back to me that were somehow missed. So
really?
So it was like, oh my goodness, we're way up and then we're way down and then we're up again, and it was kind of neck and neck. Very kind of nerve-wracking, or neck and neck. And it basically was a recount and then another sort of recount.
Yeah.
And at 11:30, I was in the Westwood Golf Club, which is where we were having our celebration or whatever it was going to be. And it was actually... one of the news people of Global came up and says, well, they've just counted you now. It's 11:30 at night. Yeah, they've just designated you now as the winner. So I was up on stage telling everybody, it's not going to happen tonight. Everybody go home and we'll see what happens. And then this guy gets up and says this. So it's like, okay, well, I'll wait till hear from my campaign manager for the official word. But it was only a win by 87 votes.
87?
87 votes, yeah.
And how many people voted in your riding?
Oh boy, roughly? I don't know what the number was. Yeah.
If it's a wild guess, like it was like 10,000 or?
Oh no, it would have been more like 30-some thousand.
87 votes.
30 cents. Yeah.
Just goes to show you that every vote counts.
Every vote does count. Yeah. And honestly, Andrew, I know all of those households.
Really?
Yes, because I, again, being a listener and consultative approach to things, when people were unsure and didn't have the background, had questions, I spent the time at the door trying to help them work through and help them with their research. Yeah. And I tried to be as factual as possible. And it turned out that was a great benefit because I got a lot of emails after thanking me for the time at the door and that they had voted for me and that they appreciated that I listened to their concerns. Yeah. So I think that really made the difference.
Yeah. Well, that's great. Well, congratulations. That's fantastic. So it's now been, about almost 2 years, I think, since you...
Yeah. May it would have been 2 years.
May. Right. So just over 2 years.
Yeah, just over 2.
And... so how are you finding it? You enjoying it? Are you gonna run again?
Oh, definitely. Yeah, I'm definitely going to run again.
Yeah,
it's interesting. Again, you it's sort of a real learning curve. So there's a number of different roles. Really, there's the Victoria role when you're there and you're in the House, and there's question period, and there's estimates, and there's all the things that are going on, and trying to get media coverage, or not trying to get media coverage, but all the stuff that goes on there. Yeah, and that's where a lot of the policy making things and decisions come from. That's certainly where all the votes come from. Then there's the constituency office, which is all the people that are coming in and need help and need assistance. Yeah. And a lot of times it's just how you navigate through a system, but other times they're really sad stories. I have a number of people that are concerned because they don't have enough money to pay for their medicine.
Okay.
Right? And it's life-altering. Right. Or it could mean death.
Sure.
And so, how do you help them? Yeah. And if we help in one area, then how can we not help in another area? Yeah. It's tough decisions. Yeah. And you're really sitting across the table from somebody that doesn't have a long time. Yeah. And just doesn't have the money.
Yeah, sure.
Right. So, the worst one for me was when they had the physicians' guidelines change for opioids.
Okay.
And a constituent of mine had been 30 years on opioids. Okay. And that allowed him to function without pain. So you could say he was an addict, but he was really just dependent on opioids to function.
Okay.
And his prescription was pulled back because of the guidelines. And he went through...
And sorry, can you go, Joan, for a second? Because I don't actually know what you're talking about.
Yeah,
so can you go into a little more detail so that I'm sure there's other listeners that don't know what you're talking about as well?
Sure. Yeah. So what happened was that with the onset of the opioid crisis, there was a certain amount of concern that physicians may have been overprescribing opioids, which led to addictions or ongoing dependency on drugs. And so the physicians themselves came up with a policy to and guidelines to reduce the prescription for opioids.
Okay.
And so people who were already on opioids and for many, many years, as is this case, you can argue that they're addicted, but they're also dependent on it just to function normally and healthily. Yeah. So this particular constituent had his prescription rolled back. And
do you remember by what percentage? Do you remember?
Well, it would be in the file, but it was it goes from so many millimeters down to so many other millimeters, and it was over time, but not enough time.
Yeah.
And he went through withdrawals.
Really?
And it was terrible. And he would phone me sometimes at 9:30 at night and say, "I don't know if I'm going to make it through the night."
Really?
The pain was just unbearable.
Yeah.
And it was like I felt so sad that I couldn't help him.
Yeah.
But these are sometimes the unintended consequences when changes are made.
You mentioned that this is the physicians that put this initiative together, but was the decision finally then made at the provincial level? No,
the physicians would set their own guidelines.
I see.
Yeah.
Okay.
And the intention, of course, was to, reduce the dependency or the prescriptions to opioids.
Right.
And people were getting addicted from painkillers.
Yeah, sure.
Because they had injuries and so on. And a certain amount of the population would get addicted.
Yeah.
And hence that's what some of the problem was. That wasn't definitely all of the problem, but it was some of the problem. And so that was their way of managing that crisis.
Yeah.
Yes. But it had unintended consequences where people like my constituent were really hit hard.
Yeah.
And really suffered. Really suffered.
And how have you advocated for those constituents in your role, considering you're not a physician? You probably don't. I mean, is it just by the fact that you're an MLA? Maybe you can pick up the phone and call some.
Yeah. We made as many calls as we could to help him, and spoke to his doctor a couple of times. And there's only so much you can do, and of course you don't want. That's the last thing you want is MLAs interfering with other organizations' policies.
Yeah.
They've obviously come to that for their own reasoning. Yeah. And we know it was to help manage the opioid crisis.
But like you said, an unintended consequence. Yeah. How's this person doing today? Any idea?
He's in very rough shape.
Really?
Very rough shape.
And is it just that he doesn't have the money to cover the difference, or he actually can't even get the prescription?
He can't get the prescription.
Oh, wow.
Yeah.
So what would you...
And one of the suggestions was for him to go to a pain clinic. There's one in Surrey, but the waiting list was something like 18 months.
Yeah.
When you're talking to people with chronic pain, there's usually a mobility issue as well.
For sure there is,
So it's not like he could just jump on transit and get to a pain clinic in Surrey. It's not possible.
Yeah.
So it has other complications to it.
So using this person as an example, what would you, as an MLA, if you were in a position where you had you were the governing party, how would you what would you do to make that change for this person and other people in their situation?
Well, I wouldn't interfere with the physician's guideline policy because that would be up to them. But I think I would make the point that there's a difference between addiction, which is a disease, versus dependency on a drug that just helps you function through the day and keep your pain management under control. I think that's the difference.
And could you, as a government, could the provincial government make some kind of change that won't challenge the physicians, but at the same time support somebody like that? Or would you have to partner with the physicians to change it?
I think you would have to partner with the physicians because it's their guidelines for the prescriptions.
So I guess it sounds to me like part of your role, unintended to expect, or maybe something you wouldn't expect going into this, is that you're advocating because of your leadership and powerful position to these physicians to at least enlighten them on one of the unintended consequences of the choices they made. Yeah. Let's talk about seniors, because we started with that, and it's something you're obviously passionate about. What are some of the things that are big issue? I'm obviously not a senior, but parents have recently become seniors. What are some of the issues that seniors are dealing with today in BC that you feel could be better addressed that aren't being addressed today?
Well, I think the biggest issue is seniors who want to stay in their homes.
Okay.
And we know that they actually do better if they stay in their home.
Yeah.
They're familiar with their surroundings. They know their home. They know their neighbors. They've lived there for a long time. They're very comfortable there.
Yeah.
They'd like to stay there, but they don't have the support to stay there.
Okay.
And so I think that would be a big focus, is providing better home support for seniors so that they could stay in their home.
Okay.
Preventative stuff. Seniors that fall, they fall usually in their home, and it's something that could have been preventable with a proper assessment. Maybe rugs have to be changed. Maybe they have to get some renovation done in their bathroom, in the kitchen, stairways, things like that are preventative, that really allow a senior to function and live life in their own home.
Right.
When something happens, like a fall or a break or something, it's very hard to recover. The older you are, the harder it is to recover.
Yeah.
And then often these patients go to acute care. Mm-hmm. And that's the most costly care.
For the province.
For the province. And it takes up beds that could otherwise be used from someone else that needs them, right?
Right.
And so it would be preventative.
Okay. So are these services that you've talked about, are they available to seniors today, but just in limited capacity? Is there what kind of changes would you make?
Yeah, so they are available, but it's the cost of the service and the support. So Home Instead is one that provides bathing, cleaning, meals, outings, takes you to medical appointments, those kinds of things, and many others do too. Yeah. But they're all private care.
Oh, I see.
So you pay for that.
Yeah. So if you have the money, you're okay.
Yes.
For the most part.
Yes.
But if you don't,
then you're under the health authority.
Okay.
And then you're under the bureaucracy of when a person can come, what their shift might be, what they're paid, and what capacity they have while they're supporting you in the home.
Okay.
Right. So I think it would be great to have a blend of partnership.
Yeah.
But we just need more people that are actually going to come out to the homes and support seniors. And it hasn't been the most exciting career.
Yeah.
A lot of people don't see that as a really exciting career, although people that are in it love it.
Right. Sure.
They love it. They love looking after seniors. Yeah. And there's no better compassionate person at the other end than a senior.
Yeah, absolutely.
They've seen it all.
Yeah, they sure have.
And they really don't care anymore. Yeah, they really do. They have fantastic stories.
They don't care.
And they don't. And they don't. And shouldn't we all be living life like that?
Totally,
right? Like, why are we still concerned about so many different things?
Yeah.
Seniors have got it right with thinking, oh, well, I'm still here. And of course, they've grown with lots of experiences, not failures, but experiences. Loss of life, losing children, having catastrophes, having to move. Lots of them moved from Europe, came here, never saw their parents again. Yeah. I mean, it was a tough time for seniors. They've gone through a lot.
Yeah. Yeah. I always had the fortunate experience of taking my grandfather, who's 95, still really healthy, and I took him and my mom to Scotland a couple of weeks ago because his parents immigrated to Vancouver in 1912 from Scotland.
Wow.
And I managed to get him on a plane. He got worked up for it. He was out walking every day for like 2 months before, trying to get himself prepared. Good for him. And I learned so much. I've always learned lots from my grandfather, but I learned a lot on that trip.
Yes.
Just listening to him talk and telling you stories. I always joke that the best part of being his age is you could probably just make up stories by this point. No one else will be able to call you on your story because no one else is around.
That's true.
Yeah.
Maybe that's part of the fun.
Yeah, exactly.
For them.
Exactly.
Let's just see how far I can go with this.
Yeah. But
I was just going to say that one of the challenges is people just entering the field as being a career that they'd want to choose. And there used to be some negatives. There used to be a high injury rate, a lot of turnover, a lot of different patients and residents that they were dealing with. But all those things can be managed. But there is a shortage of of staffing.
Yeah.
And that's
so is
that's
that
problem.
maybe one of the bigger issues is
that
maybe
is
not just
problem.
money, but also
absolutely.
a labor shortage?
Yeah, absolutely.
My observation is that from the care homes that I've been to through my grandfather and my great aunt, and it seems like most of the people that work in this industry are mostly younger immigrant women from places like Philippines and India. It doesn't seem like you find a lot of, I guess, born and raised Canadians. So is the solution to maybe recruit more immigrants from these developing countries who will come over and do that work, or is it to pay more, or what do you think the solution is?
It's probably a combination of a number of different things. But I think part of it is it's not talked about in the school system as a career option.
Right. Oh, okay.
People aren't talking about it.
Yeah.
I think we'll see some changes and some shifts there.
Yeah.
And the reason I say that is I know a number of daycares now that go visit the senior homes.
Yeah.
And they put on dances and performances, and it's just such a lovely experience to witness. So that generation will grow up being comfortable with seniors.
Right.
We're still at this, seniors are old, they expired, what can they possibly contribute?
Yeah, sure.
Which is just so wrong.
Yeah.
Because there's a lot to contribute. As you say, even the stories alone can be inspiring and motivating.
Yeah. Well, if you look at the indigenous communities, I mean, they champion the elders, right?
Yes.
I mean, they like that's a core to their their culture.
Yes. And many other cultures, the elders live with their relatives. Right? Uncle so-and-so's living with you, your grandparents are living with you.
Good point.
And we see a little bit of that now with in-law suites.
Yeah.
Right? We see people aging in place because they now have a place to age in place with their children upstairs and grandchildren. And so they have that social aspect, which is very, very important for seniors.
Yeah.
But if you look at some of the shifts in how seniors are treated, and you look at some of the assisted living and independent living homes, I mean, they're like resorts.
Right.
They're fantastic.
Yeah.
There's something going on all the time, and it is just like a neighborhood.
Yeah, sure. Yeah.
And they have their own individual doors with their own individual, signage or whatever it is. So it looks like you're walking down a street.
Yeah, absolutely.
And so that wasn't there even just a decade ago.
Yeah.
So I think we'll see some shifts where people will see that actually it is fun there.
Yeah.
It's just that they haven't been around seniors.
Right.
A lot of people just have never had that interaction with grandparents. You're very lucky that you have a grandparent that's that old.
Yeah. I'm super lucky. Yeah.
Lots of people just don't. And so they've never had that experience. But I think if people did, and there was more interaction with seniors, people would love it.
Yeah. That's great.
Yeah.
Well, let's go back to your campaign to become an elected MLA. I'm sure there's plenty of seniors in the Tri-Cities, but they weren't probably your only people. I mean, only people voting for you. What were some of the topics that either got you elected, that you connected with people on, or are things that you're advocating for today beyond the seniors? I'm not to discredit all the work you're doing in that space,
certainly.
but it's one topic. But there's probably other areas that you are first of mind in the Tri-Cities, like are things like affordable housing, employment taxes.
Yes.
It seems like there's a lot of taxes these days. So.
Oh, yes, definitely. It's funny. Coquitlam is a bit of a bedroom community.
Okay.
So in my riding, next door riding, there's very industrial. When you get into Port Coquitlam, it's industrial, blend of residential. But Coquitlam proper, in my riding, is a lot of high rises.
Yeah.
Coquitlam Center.
Yeah.
A few bigger businesses, but a lot of smaller retail shops.
Okay.
So affordability is an issue for housing, as it is everywhere.
Yeah.
But the bigger issue for the business people is the tax assessment and the levels of taxes that are put on business owners, the cost of running a business, of course, the employer health tax now on top of this.
Yeah,
so
this is big.
It's very big.
Yeah. It's a bit of a double dip this year, isn't it?
It certainly is.
Year?
No, it's this year. Yes.
Yeah.
So you're paying MSP and employer's health tax.
Yeah.
But we know there's restaurants that are considering whether or not they're going to stay open.
Sure.
One restaurant, and he's a grocer and a baker and just a fabulous downtown sort of event and place to go for a nice evening out. He had 85 staff. When the employer health tax started to come in, he decided to let the group plan drop.
Okay.
And he dropped the group plan because he just couldn't see his way into paying this. So that 85 people without a group plan
without benefits now.
Yeah.
Yeah.
So since the employer health taxes come in, he's laid off 20 people.
Wow.
So he's down to 65 people.
Wow.
So
and
this
those
is
people,
big.
And they're not getting a group. When you say group plan, do you mean benefits or do you mean
benefits?
Benefits. Yeah.
The benefits. Yeah.
Hey, Ross, by the way, while we're doing this, just so the listeners can understand about the Tri-Cities and your particular riding, why don't we see if we can pull Joan's riding up in a map so that we can kind of see the area you're talking about?
Sure.
Yeah. So he's down. So this owner is down to 65
and paying, his tax is $75,000 a year.
That's his property taxes?
His property tax, just before he gets out of bed.
Wow.
That's what he's got to pay.
That's his municipal taxes.
That's his municipal taxes.
Yeah.
And then he's got to pay all the other taxes.
Yeah.
He's got to pay his employees.
Yeah.
He's got to pay for his shipping of his material and all his goods and services.
Can we at least give him a plug? Tell everybody to go eat there and try and help him prop up business.
Oh, I'm sure he wouldn't mind. But it's Urban Gate.
Urban Gate.
Yeah.
Okay, so if you're downtown Coquitlam,
yes,
go to Urban Gate.
It is the best Persian food.
Is it really?
It really is.
Yeah.
We host a lot of events there because the food is so great, and it's a bakery, and he brings things in.
Does he make those long breads that you can get?
He does. He
eat
does.
it with the hummus.
And the tomatoes.
Yeah.
It takes 8 hours to bake these tomatoes.
Really?
Yes.
Wow.
He does it all, and it's any kind of Iranian food or Persian food that's just sort of for that ethnic food group is available there. But there's other restaurants too.
Okay.
Who another one that told me that he's figured out now he works 5 to 6 weeks with no pay just to pay his taxes.
This is the owner.
Yeah.
Yeah.
Yeah. So, this is a bigger brand chain, who probably used to make about $100,000 take home pay for hour. He's in there every day, hour after hour, managing 50 people.
Yeah.
And that's gone to pay his employer health tax.
Yeah. Yeah.
So now he's got a business risk.
Yeah.
All this capital at stake.
Yeah.
And he's not making any money.
Yeah.
So you have to wonder.
Yeah, absolutely. Well, I'm a business owner, so to speak. I employ 20 people myself here at Canaccord Genuity. I also have outside a cryptocurrency business with 3, soon to have 4 employees. And we do everything we can from a perks perspective to try and keep them around. It's we're at all-time low unemployment levels, and for most people that sounds like a really good thing, but in some ways it's difficult when you're a business owner trying to retain good people,
quality people. It's the biggest challenge.
Yeah,
it is the biggest challenge is to get good people and have reliable people. But this employer health tax, it hurts not only small businesses but big businesses.
Yeah, sure.
And there's some kind of a notion that if you're in business, you must be wealthy.
Yeah.
And it's like, well, no, you actually pay most of things. Most of the revenue is paid out in capital or wages or something. It's a very, very small margin. But
and you're taking on all the risk.
And you take on all the risk.
Like no one's going to give you a backup prize if you fail.
That's right. And who's on the hook for the lease?
You are the business owner.
Absolutely.
100%.
You can't walk away from that without going bankrupt. So, I don't know, does that make people happy? There's another employer, Gabby and Jules, and they're a bakery in Port Moody. They live in my riding, and they have a couple of other coffee bistros, Cafe Divano. And they have an autistic child.
Yeah.
And they have about 15 autistic adults that work in the bakery.
Wow.
And this gal, Lisa, is absolutely amazing. So the pies are fantastic, but she works with the parents of the autistic children. Now imagine an employer sitting down and having a plan for your autistic child who you may or may not have any confidence of, will they have a job?
Yeah, sure.
And will they be able to semi-support
cool.
themselves?
Yeah. That's pretty phenomenal.
Yes, but she's about to, like every ounce of money that they would put into that business or support their child is now taken up by employer health tax.
Sure. Yeah,
and
absolutely.
she's seriously wondering, do I have to lay somebody off?
Yeah, absolutely. Well, Joan, you've touched on a point that's really passionate for me as an employer and someone who's struggled for many years to even just get my business off the ground. I mean, people could look at me today and go, oh, he's a big success story and has done very well, but it's come with a ton of stress and sacrifice and not always been successful. And one of the things that I always seem to observe at the provincial and federal level of politics is, and from all party lines, is, oh, we want to support small and medium-sized businesses. But then when you see whoever's the government of choice at the time getting in, it seems like people forget about that. And it really is the small and medium-sized businesses that I believe are the foundation of a good economy. I mean, the big corporations have such huge balance. I'm talking big ones, like big banks and stuff. They have such strong balance sheets. They'll figure it out, you know. And then the small, you know, one-off business owners, I mean, they're really passionate about their particular practice of whatever it might be. But it's the ones that you're talking about right now that employ 10 to 15 to 20 to 30 people, where you have to really take some risks. You know, when you're working for yourself as a trade, and this is no knock against those people that do, like you're a tradesperson, you're a massage therapist, or whatever, you're just a single practice individual, you're kind of using your own labor to get ahead and you want to do it for yourself as opposed to somebody else. It's a tough job too, I'm sure, but you're not really taking on the kind of risk that somebody like sets up a restaurant, you know, or some kind of retail shop or whatever. And I guess one of my frustrations, someone who's not been in politics, but I have an interest, is like, why is it that, you know, it seems like every single time you get a new government in place, and this particular government, I mean, one of my criticisms is this constant taking of more tax dollars. It's like, this is not just an endless fountain of money, you know, and I guess, so I don't know if you have any comments on that. And the other, I guess one other point I'll make is that, why doesn't anybody in politics ever say, well, why don't we just cut back in certain areas that are absolutely obvious? When I had David here last week, we didn't get a chance to talk about it, but there's this sort of crown organization. It's called the Trade Invest BC, and I've run all sorts of freedom of information requests on this thing to try and dive into the costs that we have of carrying these foreign offices by the province of BC in countries like China and India and the UK. And I just don't really understand. Like, I know everybody says, oh, it's to try and help promote trade, but I just don't buy it. And, you know, there's so many ways in which I see the government wasting money. I mean, this whole thing with the legislative, you know, the wood chopper or wood splitter and all that kind of stuff, right? I mean, I just be curious to get your thoughts on there's my little rant on this, and why is it that, you know, these business owners cannot seem to get a partnership with the people who are in government and really give them some breaks, because it's not an easy task.
Well, there was a lot in that.
Andrew. Yeah, sorry. You set it up and I went with it.
There was a lot in there, but going back to the small business first of all.
The people you've just talked about.
So 85% of the businesses in BC are small businesses, right? And so those are the people that are employing the 1, 2, 3, 4, 5 people.
You got it. Yeah.
Right? And so we were a small business. My husband and I had a surveying company. Our kids started working there. All their friends started working there. They all put in a shift and got their letters of recommendation. We weren't a big company, but we were a company that gave people opportunity to get their experience and move forward, which is a lot of the retail jobs, certainly. Restaurant jobs, sales jobs. That is your introduction into the business world, and that's how you gain your experience and you move along in your career, right? Yeah. So they are creating those jobs. The biggest problem for them is red tape.
Sure.
And there's more and more red tape being added all the time. Yeah. And some governments are worse than others in adding red tape. Yeah. Every time you add another layer of red tape or bureaucracy, you need another 1, 2, or 3 people to handle the paperwork.
Yeah, you're right. Yeah.
So growing government is not growing the economy. Yeah. And it is not growing jobs. No. It's only growing people to handle administrative, self-inflicted, self-imposed red tape.
Yeah, absolutely.
Right? So just getting back to the employer health tax, talking to some of the people that had to fill out the form was unbelievable. To follow it along, you have to estimate what you think your sales are going to be over the next 6 months, and you're planning it all out. They said it was just, it's not like your GST. Here's your sales, you file.
Yeah.
It was all this projection. Same with the daycares. Now all of a sudden, the daycare operators are doing all the administration in the juggling of the money and who's getting this subsidy and who isn't, and all the paperwork that has to come through that. They're not paperwork people.
Yeah.
They didn't want to do that. They want to care for children. And yes, it's a business, but this is what they want to do. Now they're spending a whole lot of time. So that's like the hidden costs.
Absolutely.
That a small business has to absorb.
Yeah.
Only because the government created it.
Yeah, sure.
There's no need for it.
And I think the unintended consequence, or what a lot of people don't realize, is that if these small business owners are spending so much time trying to now learn all this new paperwork, file all these forms and everything, they're taking time away from creating more.
Absolutely.
For the economy.
Yeah.
Like, actually what you want to do, in my view, is just get out of the way as government, let them make the money that they're going to make by being creative entrepreneurs, and then pay their fair share in taxes, and you'll actually have more to work with in the first place.
Yeah, absolutely. And we know of daycares that just closed down.
Yeah.
Because it was overwhelming.
Yeah.
And that's not their forte.
Yeah,
Their
sure.
forte, and the reason they got into this business was because they cared about children.
Yeah.
And families who needed childcare. So it can drive people right out of, as it will, as we get, like, we're at the very early stages of this.
Yeah.
This is the very early. We just filed the employer health tax.
Right.
We're just getting to the minimum wage increase. We're just getting to some of the other taxes, and 19 of them introduced, right? We're just getting to
19?
that. 19 over the last year of new taxes that the government's brought in. So we're going to see the effects. It's like, you break your arm today. Yes, you have a broken arm, but for 6 weeks, you're going to feel it, right?
Yeah, sure.
Right? And it's not going to go away.
Yeah.
And depending on what the break is, it may never.
Yeah.
So it's the same kind of thing. So you make a policy, it comes into effect, but sometimes the unintended consequences don't actually reveal themselves
right away
until down the road.
Yeah.
And we can already see the cracks because we hear from people all the time.
Yeah.
And we know what it means, dollars and cents.
Yeah.
To their business, time away from their business. The old adage is, don't work on your business, work in your business.
Yeah.
Right. You need to make the difference. Like you're either strategizing about how to build your business, or you're the technician in your business. There's a difference.
Yeah. And when you're spending all that time, you don't have time to think about how to grow it, make it better, and eventually employ more people and make more money.
Exactly.
To pay more taxes.
And you have to get to a certain critical level.
You do.
Before you can actually even entertain that.
Yeah. Well, as you know, I think was it the stat, something like 80% of businesses fail within the first year, and 40% fail after 2 years, and after 2, you hopefully have made it.
Yeah.
But it is tough.
It is very tough.
Yeah.
And I've seen it all the time, where people, mortgage their homes, take a loan, buy inventory, and they're thinking ahead, and they're so positive.
Yeah.
And a year later, they're going bankrupt.
Yeah, absolutely.
And they're really not at that age, many of them, to start to make up those kinds of losses.
Yeah.
Right?
Well, anybody who goes in bankrupt, unless they're like teenagers, probably don't.
Yeah.
It's not a path that one wants to go down to.
Yeah. So free enterprise is the only way to go.
Yeah.
Where you remove red tape.
Yeah.
Get all the bureaucracy out of the way.
Yeah.
And let people make good decisions. They do. 99% of the time, make good decisions.
Yeah.
And let business develop on its own. It will, because it will get its own momentum.
Absolutely will. Yeah. Well, I know this was before your time, but I remember one of the things that Christy Clark did. And I had a time when I really liked Christy Clark, and then, I actually voted, as I told you before, I voted for David, my MLA, because I'd never voted NDP before, because I wasn't happy with the former Liberal government and some of the people that were there. But she had come up with this thing about reducing red tape. She had some kind of policy.
She
Do you remember what it was called?
Yes. It was the red tape reduction policy.
But did it ever actually pan out?
Yes, it did.
It did,
yes,
huh?
Yes. And Corley Oakes, who's in MLA for Quesnel, was actually very instrumental in putting that forward. And she worked with the Chamber of Commerce, and, she did a lot of work on that too.
Yeah.
It's all creeping back now.
Right.
Which is unfortunate.
Well, I'm not I'm not a huge fan of Donald Trump, but like every single politician, I can identify them for their policies and I can say I like these and I don't like these. Just because I don't like a politician doesn't mean I have to be critical of all their policies.
Right.
And there's one that I love by Donald Trump when he came into becoming president, and it's a policy across all federal agencies, which is for every new regulation that some bureaucrat wants to bring in, they have to get rid of 2. And I had a policy like this when I first met my wife, and she had all these shoes, and she wanted to buy more shoes. And it worked out genius.
And the marriage worked, did it?
It worked. It worked. Oh, she loved it because we moved in together. She had all these shoes. I'm like, where are we going to put all these shoes? We had a tiny little apartment. I said, I'll tell you what, honey, I'll make you a deal. I'll buy you a new pair of shoes anytime you want, but you got to get rid of 2 of your old pair.
Wow.
And she loved it. I loved it too. It was a perfect arrangement. But it's a neat policy, right?
Yeah.
Because I think what it does is it forces these, public servants or bureaucrats who are accustomed to just writing more and more. I mean, it's in a way kind of how they justify their jobs, right? Yeah. And I feel like the big difference between sort of a socialist government, like say the NDP, and a liberal government like yourselves, is that I'm assuming you guys are a bit more about small government, and they're a bit more big government. And the people in the middle are the ones that probably lean toward, they like this group because it helps justify their jobs, right? Creating more jobs, creating more bureaucracy, more red tape. And it forces them under that policy that they have to now start to rethink, okay, well, if we're going to write a new piece of policy, a new piece of bureaucracy, we got to get rid of 2 old ones.
I think it's a good idea.
Yeah.
It's a good idea because when people are in government, especially if you don't have any accountability, right? You just have a job and you just have to have performance review. It's not like you can be elected and then the next term you're not elected, you're booted out.
Yeah.
It's hard to get accountability measures.
It is. Yeah.
And how do you measure accountability measures? Because there are things that need to move forward. And so maybe there isn't 2 policies that could be tossed because this is another policy that needs to be there.
Yeah.
That's why it's so important that when you're making policies and adopting new ideas and implementing them, that you really, really think through the unintended consequences.
Yeah, absolutely.
And I think this is why government doesn't move too quickly and shouldn't move too quickly, so that they really, really hear from people, consult with people.
Yeah.
Don't just talk to your staffers. You need to talk to a whole lot of other people because people do tend to just sort of know what their circle is. And the feedback comes from that bubble.
Yeah.
And you need to go outside of that. And that's why I say on the doorstep, it's the best experience to find out what's really happening with people.
Yeah.
So it's interesting that during the 2015 by-election, there was one issue.
What was it?
And it was the Evergreen Line.
Okay.
We got to have transportation out there. And it was like on every doorstep. We got to have transportation. My kids they have no way of getting downtown, blah, blah, blah. And so it came. So the next issue after it was the feeder buses. So to get off the mountain and Burke Mountain or Westwood Plateau, the buses didn't run frequently enough to get people down to the hub to get onto SkyTrain. So they kind of worked that out with the city and so on. So when we got to 2017, it's like, what is the issue? We got that big one knocked off. But of course, it was housing affordability. And my kids want to live here and they have no chance of giving having a home here and buying a home and and so on. And what's really interesting about that is when I was door knocking up in Burke Mountain. So there's some very lovely homes up there, upscale homes, and sometimes grandparents would answer the door, and they would say to me that they offered to help finance their grandkids' house. They would lend them some money. So they could get in the house, provided they followed a budget.
Wow.
And they didn't want them eating out 3 and 4 nights a week.
Yeah.
They had terms to the loan.
Yeah.
And the kids refused it.
Really?
Really?
They weren't willing to make the sacrifice.
They were not willing to change their life, even for a house.
Amazing. Wow. Well.
Yeah. So when you go back, it's weird, isn't it?
Yeah, and we could go into a whole nother subject about.
Yes. And you go back to, when we bought a house.
Yeah.
I mean, or even when you just moved out to your first apartment.
Yeah.
It was, mason blocks and wood.
100%. Yeah.
Right? That was our TV stand and our book stand.
Yeah.
And it was, Auntie Betty's mattress and Auntie Minnie's dining room table. And that's how you set up house. Yeah. And then when you moved into your first house, you kind of had that too. Yeah. And it was over time.
Exactly.
You got all these things.
Yeah.
But right now it's like you move in ready, turnkey, and pretty nice.
New. Yeah.
Pretty nice.
Yeah, it's a whole nother topic we get into about the millennials. Okay, well, we're going to take a quick break with Joan Isaacs, and this is actually a great segue. Not about the young people and all their new stuff they need, but actually, you talked about affordable housing and that type of thing, and we have this article here about this woman who helped. I think you advocated for her. She was a widow, a 78-year-old widow who was being hit with the speculation tax, and it's been a theme I've talked with almost everybody that's come in here. So I want to spend a few minutes talking about that. We're going to take a quick break. When we come back, we're going to talk about this topic. Okay, back with Joan Isaacs in a moment. Thanks,
Sounds
Joan.
Good.
Great. Here we're back with Joan Isaacs. We're going to wrap this up soon, Joan. It's been a great podcast so far. But I do want to jump into this really well talked about and one that's important to me, which is this speculation and vacancy tax. Mm-hmm. And one of the ways in the way we connected was actually through Neil Belenky, who was here a couple of weeks ago. He's the mayor of Belcarra. He's very vocal about how his constituents and his municipal environment are being hit with this tax. And you support sort of the challenges that he's challenging the provincial government on, but why Belcarra is even part of this doesn't make any sense. So whether it's that topic and Belcarra, it's not even actually your riding. Are those people, are they part of your riding?
They're not part of my riding. They're one of those boroughs.
Right. Yeah.
But my constituent that actually brought this to my attention lives in Burke Mountain as well as Belcarra.
Okay.
And he has a cabin in Belcarra and a house in Burke Mountain.
Okay.
And his cabin is actually his primary residence.
Okay.
And he bought it as just a small little rustic place with a little bit of acreage because he has a daughter that has some challenges, and it was a place that she felt really happy and protected there, and so they spent most of their time there.
Okay.
But her programs were in Port Coquitlam.
Okay. And
so he was doing the drive every day, which can be a half an hour to 40 minutes, and a couple of times a day. So he ended up buying a house in Burke Mountains just so that his wife could transport her back and forth to the programs and then come home at the end of the day and on weekends. So when he came to tell me about the spec tax, his bill that he was looking at, and he's a pensioner, was $45,000 a year.
Holy smokes.
Yeah, $45,000 after tax for a pensioner. And there was no way he could sell his Belcarra home because that was his principal.
He must have a very highly assessed value of a home then.
Burke Mountain would be highly assessed, but the property in Belcarra had gone from, 30,000-40,000 to a few million. Just because it was on the lake. So by no fault of his own, it wasn't an investment. It certainly wasn't a speculation. He bought it 30 years ago, I think it was. So it's not like he was buying the property to turn it around for a profit at some point. He bought it for a specific reason.
Right.
So he was hit very hard. And then he was telling me that there were a number of people in Belcarra that had similar situations where they had cabins. Some of them were not even accessible by road. It had to be through by a boat.
Yeah, that's what Neil had talked about. Boat access only. Some of them not even insurable.
Yes. Yeah. So my constituent put me in touch with Neil. And of course, I hit it off with Neil right away because we were on the same path. Like, why are these people being punished?
Yeah.
They're not speculators.
Sure.
And you know what, Andrew? A simple little question. Like, have you held this property for less than 5 years?
Right.
Pick a number.
Easy.
2 years.
Yeah.
But whatever it is. If the answer is yes, I've held this property for more than 5 years, you're not a speculator.
Yeah.
End of story.
Sure.
Instead, all these people had to go through all this grief.
Yeah.
And, provide information that they felt they didn't need to provide, including social insurance numbers.
Right.
And this one particular woman who was in my constituency, she was a widow, a recent widow, had been widowed in September. Her husband made all these decisions. And so her and a few other widows that lived in the same complex were all talking about what are they going to do? How are they going to manage? You know, they want their social insurance number. They've been told never to give their social insurance number. So she ended up calling me, and we ended up helping her through the process. And really what happened with her, and many others came to our attention after that, is it takes some time for an estate to settle. It takes some time to do a name change from a house in joint names to the surviving spouse.
Yep.
And she got caught up in the spouse who was deceased. His name was still on the title. And when she phoned to ask how she should handle it, and said that he's not even here, he's deceased.
Yeah.
The other end of the call said, he's going to have to pay anyway. And she was in tears.
Right. I mean, we're laughing.
How do we do it? Yes.
What a horrible situation.
It was a terrible situation. She was so frightened.
Yeah, sure.
And she was literally shaking on the phone of, I don't know what to do. And the person basically said to her, Madam, you will have to pay. You know, you never talk to a senior like that anyways, but you should never talk to anybody like that. So it was a very frightening experience for her. But we managed to get it solved because we could work with the land title office and have it changed. But, you know, it's a big deal to change these kinds of things, and for seniors in particular.
Yeah.
Right.
Yeah, sure.
And many of the people in Balcarra, their cottages have been in the family for years, some of them 60 years.
Yeah.
Being passed down from generation to generation.
Yeah.
And they're seniors.
Yeah.
And
they're not speculators. No, not at all.
And they really
good luck
felt
trying
offended.
to rent them too if they're vacant. Water access only, can't be insured.
They're thin walls. They're thin walls. And the people, you know, the comment that got me the most, knowing that I had relatives that had cabins too.
Yeah.
It is their home. It's their summer home. They've got their stuff in it.
Yeah.
And they'd have to move all their stuff out and have someone else put their stuff in the house that's been theirs for 60 years.
Yeah, sure.
It's like very offensive.
Yeah.
And not practical at all.
No, not at all.
So it should have been exempted.
Yeah. Okay, so that's good.
Yeah.
I agree with you.
Yeah.
I think Neil agrees.
Yeah. And Neil's done a fantastic job in, you know, what a great mayor.
Yeah,
He is fighting for those people.
Now let's dial the speculation vacancy tax back to the core of your constituency, and like you represent areas where you at the beginning of our podcast talked about, you know, affordable housing development. What are your thoughts? Is this thing working out for people in your riding as far as like, is it freeing up homes that it otherwise wouldn't have?
I don't see anything.
You're not seeing it happen?
No.
And how come? There's no vacant properties?
No.
There's no people from overseas buying houses.
Well, you know what? There's a couple of people that have contacted us. One in particular who bought a condo in Coquitlam with the intention of moving here at some point, still working in the UK.
Okay.
The daughter and son-in-law are in another condo. They're having a grandchild soon. And so these people wanted to move in and have that place available. They just bought it a few years before.
Okay. Come visit and see their grandchild. Yes, and they
stay, periodically for when they take their holidays.
Sure.
And they couldn't believe they were being charged speculation tax.
2%.
And they're not speculators. They bought this so they could be close to their daughter and son-in-law and grandchild when they finish retiring. In the meantime, they use it for vacation. Mm-hmm. So there are stories like that. And we hear a lot about people that says, I can't rent it out because my bylaw says I can't rent to anyone, or it's a age restricted building. So you have to be 50 plus. So that leaves a lot of people out of the market. So it's fraught with a whole bunch of complications that are, again, these unintended consequences that really could have been avoided by just kind of thinking the process through a little bit better and making sure that you really were targeting the speculators.
So how would you have written the policy? Would you,
one of the things was, as I definitely would have said, how long have you held this property?
Right.
Because right there, by virtue of that, you either are a speculator or you're not.
Yeah,
if you held it for less than a year, and I don't know what the number would be, but if you held it for less than a year, maybe you are a speculator.
Yeah.
If you're renovating the property with the intent to sell, maybe you are. If you're holding on to the property for the market to go up, maybe you are. But if you're holding it because you're going to move somewhere, from somewhere else, and then take up residence in the property, and that's your intention, then you're not a speculator, but you are deemed to be a speculator.
Yeah.
Right. So a few more pointed questions, I think, could have been better.
Yeah.
I also had big concerns with the social insurance number and taking that data because it was not necessary.
Yeah.
You know, your social insurance number has nothing to do with your real estate transaction.
Well, isn't the social insurance number expected to tie in with this new thing that's coming, I think, in the fall, which is the beneficial ownership registration? I talked about it with David, and apparently they're going to have a public registry where everybody will be able to see who owns what. I mean, you can kind of do it now with land title, but it costs money, and it's not it's pretty cumbersome, and you have to have an account set up with BC Online and whatnot. But I mean, I do agree. I mean, to me, it's a bit of a double-edged sword. Like, I guess the advantage of the social insurance number is then you get to see who are the owners of these properties. I mean, there's a lot of talk about that the mainland Chinese have driven up prices, and, you know, this foreign money has driven up prices, but nobody really knows because there's no registry. But then if you have a public registry, you have to collect all this data. It's kind of a bit of a challenge to figure out that answer.
Yeah. I'm not sure if that's the answer or if it's a tick.
Yeah.
You know, are you a permanent resident? Do you live here for more than 6 months? Do you live here for less than 6 months? I think there's other ways of getting the information.
Instead of giving up yourself.
Yeah. And so we're talking about a small portion of the population that may be in that category.
Yeah.
We're talking about the rest of the population that are not.
Yeah.
And they had to file in the same way as if you were possibly in that category. And I think that is the issue.
That's the way,
that was offensive to people.
Yeah.
It's like, I feel like I have to report my personal information when I'm not a speculator.
I admit I had to, and I didn't like it.
Yeah.
It felt kind of odd.
Yeah.
You know?
Yeah.
First of all, it felt odd because I thought the government would have it anyways, but it makes sense that they don't because the provincial government, federal government, and they're asking you for information about a different jurisdiction, or I guess you would say.
Yes, and people are rightfully concerned about their privacy.
Well, especially today.
I mean, Desjardins?
Yeah, well, exactly.
Desjardins. I mean, good heavens.
Well, everything. I mean, I think was it just like a couple of weeks ago, like, you know, always, it's like almost every week there's like Google's had a breach, Facebook's had a breach. I mean, I got to think that probably the province of BC at some point is going to have a breach. Yeah. And they have a lot more data now than they did before.
Yeah. And this was in Desjardins' case, an employee that released it.
Right, that's right.
So how do you manage that?
Yeah.
If someone's going to go off the rails and not follow the rules, they're going to do it. You can't really legislate that.
Yeah. Yeah.
Right?
Yeah. So you're not seeing the speculation vacancy tax really having any kind of the impact it's intended to have in your riding, at least?
No, because I'm more of a bedroom community, and I think for some of the people that I know that have cottages and that, they're not in the areas that were captured.
Okay.
They're in exempted areas, so they were lucky.
Yeah.
That, you know, like Pitt River.
Right.
There's a lot of cabins up there.
And they were
Lake,
exempted.
Harrison Lake. Yeah.
Okay.
Yeah, they were exempted.
Well, before we wrap this,
that's the other concern is, you know, when you're capturing areas and you need revenue, because we know the revenue is down.
Yeah.
It's then will that area expand to a new area?
Right.
And so they may have learned a few lessons, but when you have a government that wants to create revenue, and the only way of creating that revenue is through a taxation stream, then you have to have that concern of whether or not your property that's exempt now will end up paying speculation tax somewhere down the road.
Later on, or a different type of tax.
Yeah, yeah.
Well, this is actually another great segue into, like, let's just before we finish this, I wanted to ask you, are there other things that, as the, you know, official opposition in BC, and someone who's obviously really, you know, taking this seriously in your early career as a politician, are there any other things that you see on the horizon with the current NDP government that you want to address, that you want to kind of speak about, that you're like, you know what, this is, pay attention, folks, there's a red flag here. Keep our eyes on this one. Is there anything in particular?
Yeah, you know what, I would say the community benefit agreement.
Okay.
And there's kind of two things. So the community benefit agreement is basically, and you hear it on the news, how great it is. We're going to hire locals. We're going to hire Aboriginals. We're going to hire women. Well, we already do that.
Yeah.
We already do that.
Maybe for just layman's terms, can you explain to the folks who are listening what the community benefit agreement is?
So this is the NDP agreement, whereby companies that are bidding for projects will bid through this community benefit agreement. There are only 19 unions that are captured in this community benefit agreement. So if you're a union that are outside of those 19 unions, you can bid, but within 30 days you have to join one of those 19 unions.
Really?
So many
and if you're not union?
Can't bid.
You can't bid?
No, it's for community benefit agreements. So you have to be one of those 19 unions in order to bid on a project, and you can bid on a project. You can get a project, but within 30 days you have to join one of those unions.
I gotta assume that these unions were big donors for the NDP,
and they were.
Okay.
Yeah, and they were, and but what happens now is it just drives up the cost.
Sure.
So everything that was sort of on the books, per se, infrastructure-wise, Petula Bridge, some of the work in Revelstoke, some of the work on the highways, it's 25 to 35% more now for the same job.
Wow.
And that's, of course, because now we have to pay different wages.
Right.
They will say it's we're training, we're apprenticing, we're doing all these good things, but all the other unions do that too.
Yeah.
And so do the non-unions.
Yeah.
So it's the best working formula is a combination where you have a blend of different workers and you have a project and you see the project through. And of course, there's always some cost variances because if you ever renovated a house, you open up a wall and it's like, oh, we didn't know that was there. It's going to cost more, right?
Yeah.
So there's going to be some variance.
Yeah.
But when you're starting off with just wage variance and benefits, then it's not competitive anymore.
Yeah.
And you and I are paying for it.
Sure.
So that's one issue I have.
Well, you also know that if you're kind of an exclusive group, why would you focus on keeping your costs down and being competitive? I mean, if you're only one of 19, it's
absolutely.
Almost sort of an oligopoly. I mean,
and it is. And it's that point again about accountability.
Yeah.
If you're the only one bidding.
Yeah. Take advantage of it.
Absolutely. And why wouldn't you?
Yeah. Absolutely.
So it does sort of that's a big one.
And is that in place today, Joan?
That is in place today.
Okay.
Yeah. Yeah.
And these are for big infrastructure projects that the province is going to be spending money on.
Yeah.
Okay.
One of the steel companies took out a full-page ad in the Globe and Mail in February.
Okay.
And wrote down all the reasons why this is the wrong thing to do.
So they weren't one of the 19 unions.
No, they weren't. Yeah. And I have another friend who has a company, a crane company in Coquitlam. He's been doing this work for 30 years, and he was excluded.
Amazing.
For 30 years.
For 30 years, contributing to the local economy, creating jobs, paying taxes.
So he worked it out by piggybacking now on another union.
Okay.
But that's not the way to do it. That's not a competitive. That's kind of like
Yeah.
It's not just it's not a clean way of doing business.
What's the other one?
The other thing is the healthcare workers, and in particular the home support workers that were independently contracted to provide services and support for seniors living in their home.
Okay.
So it used to be that you could deal with them directly. And if you liked their service, great. If you didn't, you move on. That has all now moved into the health authorities.
Okay.
So we just created a bigger bureaucracy, another hierarchy level to get the same service for seniors. And it's going to cost more.
And the other program was already working.
And it's going to cost more. Well, there's the shortage of work. There's no question about that. There is turnover. There's no question about that. And that there's burnout and there's all kinds of things. I think we were better off to support that industry, if you like, or support the workers there so that they had the proper resources to provide for seniors.
Yep.
That would have been a better measure, but they need people to do that.
Yeah.
But taking those services and running it through the health authority just created a big, huge problem. And so I know they're tracking data, and people are quite concerned about how they're tracking data and what it really means in terms of somebody's life.
Sure.
I need someone to come at 5 o'clock, to get a dinner ready, or to put someone to bed, or to get someone up in the morning. Those are serious lifestyle issues that, when you get into a complicated bureaucratic system, it's not efficient anymore.
No. And those things get delayed or lost and people get affected.
Yeah. And so it compromises someone's well-being, their stress level, their anxiety for not only the person that it's happening to, but also their family members.
Yeah.
Right. So I think growing government again, being a bigger bureaucracy is not the answer.
Yeah.
I think there's ways we could have improved and should be improving, and new ways and more creative ways of helping that sector to provide for seniors, because I think it's going to be a necessity, because they can't all be in acute beds later, right? So we need that preventative thing.
Yeah.
And we need people understanding that elder care, geriatric care is specialized even when they get to the hospital. And we need more people there that are more in tuned and sensitive to what the needs of elders are.
Yeah.
But I think there's a way of getting there.
Yeah. But it's not through bigger government.
It's not through bigger government.
Yeah.
We will never get there, I don't think, that way, because now you've just got a big bureaucracy to deal with.
Yeah. And more costs.
They
get passed on to the baker.
Yes.
Who had 60 employees and now has 80 employees and now has 60.
Yes. Yeah.
It all ties together.
Well, and they did increase their prices, and others have too. But there comes a point where how much are you going to pay for a hamburger?
Yeah, exactly.
Right?
Yeah.
15, okay. Are you going to pay 20?
Yeah.
Are you going to pay 25 next year? I mean, at some point, it's just people won't even go out.
That's right.
And we're seeing that now. Is people, the restaurants are reporting that there's less people coming in. And
you see it all over the place. Restaurants closing down because they can't increase their prices anymore, and they can't keep enough staff.
Yeah. So free enterprise all the way.
Yeah. Well, Joan, thanks for being here today. This has been great to come all the way down from Coquitlam-Burke Mountain, and I appreciate you taking the time to come and see me today.
Thank you, Andrew. Thank you, Andrew. I really appreciate the opportunity.
Yeah, thanks.
All the best.
Good. Thank you. Thanks. Nice seeing you. Yeah.